Dr. Jane Philpott may have left Parliament in 2019, but she's never really stopped engaging in the national debate. Canada's health minister in Justin Trudeau's first cabinet, she has in recent years talked about the healthcare crisis. Right now, there are roughly 6.5 million Canadians who do not have access to primary care. It's a situation that Dr. Philpott says should outrage Canadians, a problem for which she has a prescription, and it's all outlined in Dr. Philpott's new book, Health for All. Well, we are now joined by Dr. Jane Philpott. Dr. Philpott, good to see you again. Thank you for being here.
I'm happy to be here.
Now, this book, Health for All, that you wrote, it delves into so much, and you share a lot. You share personal stories, stories of spiritual exploration. You talk about your time as a politician. But I do want to begin our discussion about your reflections on the current state of healthcare in this country, because as you note in the book, 20% of Canadians, roughly, do not have access to primary care. And to carry on what else you say in the book, you say, if this were public education, Canadians would be up in arms. So why aren't Canadians, why aren't politicians up in arms when we hear that over 6 million Canadians do not have access to primary care?
It's a fantastic question, and you're quite right that things are really in a desperate state as it relates to health care. It's happened somewhat gradually over time, that we built an amazing system where everyone had health insurance for care in hospitals and care by doctors. And I think there was a complacency about healthcare that we thought that that was great, and it is great. But then the pandemic hit, and it blew open the cracks that were in the system, and they've never come together again. And we've reached this state, as you said, where so many people don't have a family doctor or any other form of primary care. And we've sort of had the sense that it's not fixable. And so there's just despair in the streets and despair in the health systems. But my hope with the book is to say it doesn't have to be that way. We could be like other countries that have everyone in the country attached to a primary care home.
Okay, let's talk about that, because you do have a prescription for this system, as you say, that is broken. And it is centered around primary care homes or teams that would be tied to postal codes. Walk us through, how would that actually work?
Well, as I say, it's not built just on my imagination. It's built on the fact that there are actually many countries, most of them in Europe, that do this, where when you move to a new neighborhood, you insert your postal code on the website, and it tells you that down the street in your corner is the primary care home, where there will be a family doctor and a team of others, including nurse practitioners or nurses, who will help to take care of you. And when you move to another community, you will be reattached to another place. Like you said, I used the example of the fact that we have assumed for a long, long time in this country that no matter where you move in the country, your children will have access to elementary schools or secondary schools. That's a given that we all understand. Why haven't we built that for primary care? We could.
Okay, and not to talk like a bean counter here, but it sounds expensive.
At first glance, it sounds like it would be expensive, but in fact, it's actually one of the least expensive parts of the healthcare system. So we spend most of our money in healthcare on hospitals, as well as doctors and drugs. Those are the top three things that we spend money on. But in fact, if you actually give people the care they need up front, you're going to save money in the end. So what happens with this 22% of Canadian adults who don't have access to care? No one is screening them for cancer. No one is following their diabetes and high blood pressure over time. And we wait until they have a heart attack or they have late-stage cancer and they show up at the hospital. Imagine if we had treated those people earlier or detected their cancer earlier. It would have been much more affordable, not to mention, of course, they'd have a better chance of surviving.
Mm-hmm. Although, and correct me if I'm wrong here, before you entered politics, you did basically open up a medical practice that leaned heavily on this team care philosophy. And that was part of an experiment that was underway in Ontario, which at the end of the day was cut back because they concluded that for the most part, the people who actually benefited from that system were people who were financially advantaged or were well off already.
I can tell that you've read very carefully, so yes, that's quite true. And you're quite right. In Ontario, for a while, we had the amazing opportunity of physicians becoming part of family health teams, and about a quarter of the people in Ontario are part of a family health team. For them, that works really well, and it's an amazing way to get care. But as you said, it was not universal. I'm not sure whether they ever intended it to be universal, but it has to be universal for everyone, because we don't want a quarter of our population, and usually they're the people who are the most advantaged that jump in and find out about these opportunities early on and get signed up, and you leave behind the rest of the population. If we could have that for everyone, it would actually be more affordable for us, and it would certainly be more equitable.
Now, you go on to say in the book, not only make this prescription, you also basically say that the federal government can pick up this model, can make legislation that essentially shifts how healthcare is delivered in this country and support provinces and territories. But we currently live in an environment and with a government that has already been criticized for funding national child care. Provinces says it interferes with their jurisdiction. They have been accused of overstepping with carbon levies. They have been accused of overstepping when it comes to housing, and more recently the introduction of a national food program for schools, which again, from the provinces, they say that is their jurisdiction, not Ottawa's purview. So how can you make the recommendation that it can start with Ottawa?
Well, it can actually start anywhere. I think you're quite right in that. A province could decide to do this. They could, of their own accord, say, we're going to make sure everyone in our province has access to a primary care home. And that would be fabulous. I hope some of them will do that. And we see a couple provinces that are maybe moving in that direction. None of them have fully done it yet. But the federal government has to take leadership on this. And we've seen when great things have happened in healthcare in this country, it has included federal leadership and federal legislation. You know, going way back to the first Hospital and Insurance and Diagnostic Services Act decades ago, and then eventually the Canada Health Act, those were the places where Canada said, we are a nation, we are going to set certain standards for ourselves, certain principles by which healthcare will be delivered. The provinces will operationalize it, but the federal government will make the investments and set those standards. And it's time for us to see that happen again.
Do you see that kind of cooperation happening, though? You know, we live in this very hyper-partisan era, not only between political parties here in Ottawa, but between Ottawa and the provincial capitals.
Well, you're quite right, and I mean that's part of why, as you say later in the book, which I know you're going to get to, I talk a bit about the political culture, because health is something that I believe Canadians really want their governments to get together. I mean, at the end of the day, we pay taxes to our federal government, we pay taxes to the provincial government. We don't actually care who delivers the services, we just want access to care. And we expect governments to be able to cooperate. And where we have seen great health and social programs in this country, it has been when the federal government and the provinces and territories have sat down together and agreed upon what is right, what is necessary for the people of the country, and said, we're actually going to collaborate on this, we're going to build consensus. I believe it's possible. You're quite right that it's hard to do in our current context, but it's absolutely possible.
You know, I'm wondering, given the fact that you are well known across the country, given the fact that you were at one point a part of the current government in Ottawa as a health minister, even in the Trudeau government, have any of your former colleagues, because this is not the first time you've actually talked about creating this type of care team model, I'm wondering if anyone from your old team has reached out to you to say, how do we make this happen, Jane?
I've had a few conversations, probably more with caucus members than with ministers, but I've had some great conversations with some people in government and across all parties, and about, you know, how we can do better. My efforts in this are very much nonpartisan, and I really hope that as people read the book and hear about it, I would like to see all parties consider what they could do for Canadians and have a vision, which I'm not hearing much about at the moment.
Okay, you say nonpartisan, and if the poll numbers are to be believed, if an election, should an election happen next year, as is the expectation, if the polling holds, it's going to be a Conservative government. Are you willing to sit down with the Pierre Poilievre government and walk through how they can improve healthcare with this plan?
I want every Canadian in this country to have access to primary care. I think that any partisan and any party could be the party that could deliver this. We have seen in the past that conservative governments, you even look back to John Diefenbaker, and he had a big role to play in some of that early legislation. I will work with helping anybody who wants to be able to deliver this and share those ideas. I'm not the only person who has this kind of vision. I have lots of colleagues in the world of primary care who would be happy to be part of this, and I certainly hope whoever is in power will take this seriously and make sure that Canadians get access to the care that they need, because there are few things that matter to Canadians as much as the health and well-being of their families.
Okay, now, as we said, this is your prescription based on others, other discussions. This is your prescription for improving primary health care. But let me pose to you another prescription and get your thoughts on it. Because when you look at the UK, when you look at Australia, they actually have a mixed public-private system. And we hear that argument. You know, if the healthcare system's in crisis, enable more private care providers, take the pressure off the public system, and deal with wait times and increase financial efficiency. What do you say to that?
It's actually something that does come up very often. You're quite right. And I would say that the whole public-private debate is a red herring. It's not the biggest problem in our system, nor is it the biggest solution in our system. In fact, Canada actually has a very relatively small proportion of our healthcare that is public. Surprisingly, only 70 to 75% of our health spending in Canada is public. The rest of it is already private. We look to countries like the Netherlands as a great example where, yes, there is private expenditures in healthcare, but still 85% of expenditures in a country like the Netherlands is public health spending. So we actually could spend more proportionally of our healthcare dollars in a public manner on doing things like primary care. In the end, we would potentially spend less per capita and get better health outcomes.
Dr. Jane Philpott, quite the book to read. Thank you for this. And the book is called Health for All. Dr. Philpott, thank you.
Thanks for having me.